Kagwe, the UNESCO Regional Director for Eastern Africa, Professor Hubert Gizan, the Chairman of the Media Council of Kenya, Mr. Maina Muirore, Council members, Media Council CEO, Mr. David Omoyo, media stakeholders, members of the Fourth Estate, invited guests, ladies and gentlemen, good morning. Is this what? This is not working, no? Okay, I think that's better. Good morning again. So it gives me great pleasure to be here this morning to witness the launch of the Media Council of Kenya, of COVID-19 Health Information Portal for the media practitioners. I will start by commending our media for their reporting and informing public on the COVID-19 pandemic, despite the many uncertainties and mysteries surrounding it. I must say that media outlets across the country have prioritized coverage of the pandemic, creating awareness and boosting the vaccination exercise. This has in turn contributed to the behavioral change amongst the population, resulting in a reduction of the infection rates. However, the ever-changing and sometimes unverified nature of COVID-19 information has left journalists and researchers with challenges in providing accurate information to the public. While the virus has negatively disrupted society, there are still many gray areas that have yet to be cleared. We have seen vaccine deniers who have peddled all manner of conspiracy theories about the vaccine, many bordering on the absurd. So I'm very happy today. We have our Chief Doctor of Corona, Honorable Mutahi Kagwe, and it's worth mentioning that even before this, he was Minister of Information, so he had the same position that I have today. So he's very experienced, and I think while vaccinating prisoners, I heard him mention something about transformers, and I'm hoping that today he's going to give us all that information, and you know, that can then be available on this portal to ensure that we will all understand the challenges. COVID is here with us and is here to stay, and so we must find ways of how we will work with it amongst us and ensure that our economies and livelihoods continue. And so I'm pleased that he's here. And even though I have a speech which I was going to read as a whole, I think it is better to listen to our chief guest and hear the wisdom that he will bring to us. Mine will be first really to thank the media for really the effort that you have put in ensuring that as a country we've remained informed, and that even our practitioners are able to share the information and knowledge in the way that is required so that we make the right decision. I also want to thank the Media Council, who we now work very closely as government and are able to ensure that the Fourth Estate is also able to provide citizens with verified information. You said we should not talk about fake news. We should talk about other news. And I think the way we are moving, it is clearer and clearer for Kenyans what is true and what is not true. But we do need to have arbitrators that will actually say this is true and that is not true. More importantly, we today as a country start the exercise of voter registration, the search for the 6 million young youthful voters who we encourage to go out there and actually register so that they can be able to participate in determining the destiny of our country. But for today, it's great that we have a portal that is going to provide all the necessary information you need as far as COVID-19 is concerned and how to live with it. And we hope over time, even other pandemics, any other situations that come, will create more and more portals so that there is a central repository of the information. So let me end there, and really I'm looking forward to hearing Honorable Senator Mutahi Kagwe explain to us all the intrigues of Corona, and also his personal testimony, I hope, will be available on the website or the portal that is being launched. So please be upstanding. Let us welcome our chief guest, Honorable Senator Mutahi Kagwe, to address you.
Thank you all very much. Please, let's sit down. My brother and colleague, Joe Mucheru, Cabinet Secretary for ICT, Innovation and Youth Affairs, Mr. Professor Hubert Hazen, I think I got that right. Yes, Professor Hubert Hazen, who is the Regional Director of UNESCO, the Chairman of the Media Council, my friend and former colleague, Maina Mwiruri, the Media Council CEO, David Omoyo, the council members here present, media stakeholders, all members of the Fourth Estate here present, invited guests, ladies and gentlemen. Let me start by clarifying one or two things. You know, I know my brother Joe spoke to the issue related to energy. He spoke about something to do with transformers. And that, you know, there was a change the other day in the government, but I wasn't taken to the Ministry of Energy. So the energy bit, I will leave out for now, but confirm that vaccine works, nonetheless. May I also take this opportunity to really congratulate the Media Council for today's launch of the information portal. I think that is a milestone. I think that the Media Council has come a long way. My brother Mwiruri, years back in 2006, 2007, I remember my relationship with the media, a little fighting here and there, but eventually I think that the Media Council has really come to its own space, and I want to congratulate you, for launching this portal. But in addition to that is also the tremendous amount of work that you and your members have continued to render to this nation, holistically in terms of the improvement of our democratic space, oversighting government as you should, but also educating our masses and informing them on the various aspects of life, not just health, but educating them as a whole for the betterment of our country. I also want to commend the United Nations Education, Scientific and Cultural Organization, UNESCO. Professor Hubert, thank you so much. I want to say thank you on behalf of Kenyans, not just on behalf of the Media Council, but on behalf of Kenyans for the work you have continued to do. We are lucky that your headquarters happen to be here in Nairobi. And for that, we continue to be grateful to the UN organization and the UN bodies that exist here in our nation, and urge Kenyans to continue to cooperate with you in all ways that we can to make your stay as our brothers and sisters as happy as possible here in our nation. And therefore, as you work with the Media Council and other stakeholders, I think it is good to note and take cognizance of the fact that it would be very discouraging if UNESCO was here and you didn't work with our own media. The fortunate thing is that you do work with our media and through the Media Council, and we are excited and we are grateful and we are thankful that you have continued to do so, and we hope that the future can only be brighter. I also want to say that through the media, we have done a lot together. You and I know this, Mwiruri. We know that on the outbreak of the COVID-19, I wasn't any wiser than the next person about what this virus was going to be all about. You and I were in the same space, but we struggled on. And I think through the struggle, the containment measures, the information flow, the lack of information, we struggled through it all together. And I call upon the media to embrace responsibility in reporting not only on COVID-19, but also on general health matters. Biased reporting, as Professor you rightfully pointed out, does not only create despair among the population, but also builds mistrust with state intervention to contain spread of the disease. But you know, COVID-19 has had a unique way of handling its critics. You know, if you did a little research on this, you'll find that most critics, the highest critics of COVID-19, those who have been quoted extensively as saying there is no disease called COVID-19, those who have been quoted extensively as having said that the vaccines don't work, etc., 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 have somehow found their way out of the scene. If you see what I mean. So this disease, as I said sometime in last year, somehow does not behave normally. And those who have treated it normally have unfortunately been treated by the disease very abnormally. And I think it is good to be on the right side of this one rather than on the wrong side. You know, and it's a funny coincidence, if one may call it so. But being a new disease, COVID-19 has presented itself as the mystery infection to the medical field, requiring tremendous research and insights about its nature and posing a lot of challenges globally. The global spread of the pandemic has been mirrored by diffusion of information, conspiracy theories about its origin, about its motivation, etc., etc., etc. To this day, I don't think there is a lot of clarity, specific clarity, regarding exactly what happened in Wuhan city. I don't think anybody can stand here and hold the Bible and tell me this is exactly what happened in Wuhan sometime in the year 2018. I don't think so. So we simply can go by what we know and believe that since we are seeing results by the measures that we are taking, assume that the research is continuous and we are going to continue learning a lot more about this disease. And because of that, because we expect to continue engagements with this virus, it is only right and fair and very apt and timely that we have launched this portal at this time. And I think that moving forward, you are going hopefully to be as interactive as possible on the portal. We hope that you are going to widen the scope of what you are going to be covering. We hope that more information will appear on the portal as we at the Ministry of Health continue to receive it. What I can tell you is that we will continue as a ministry to cooperate with you, to cooperate with UNESCO, and to cooperate with stakeholders as much as we can in order to give you all the information, efficacious information, because we also don't want to just give you information. To this end, I also want to thank my brother and colleague, Joe Mucheru. You know, when I joined the Ministry of Information, there was very little we could do because of human capital, the human capacity that we had in the ministry in terms of information outlet was very, very little. But today, because of your help, we can boast of a sizable group of people who we are working with. The communication desk at the Ministry of Health has now got a substantial amount of people. All of them come from the fourth estate. So they are people that you know personally. Some of them have worked in various media organizations, so you know them personally. Others are consultants that you have worked with. We have got at least 3 people who came from Kenya Broadcasting Corporation who are familiar with most of you. So in terms of our capacity and our ability to execute information flow from the Ministry of Health to yourselves, we have built substantial capacity. And I want to thank the Ministry of Information for that assistance. Therefore, the pandemic requires effective and well-coordinated public communication to enhance public response and elicit cooperation. Particularly, the eliciting of cooperation is where it all lies. Because we have often said that by the end of the day, discipline in our communities is what is going to help us in this fight against the pandemic. But how do we create discipline? Discipline is created not just by stick. You know, I'm not one of those who believe that the only way you create discipline in society is by beating them up. You cannot create discipline by beating people up. You can create fear, and it doesn't last, and it is not healthy. It just makes the budget of the Ministry of Health more damaged. But what we believe in is that discipline should be created by information. We give people as much information as possible. We tell them the pros and cons of their activities and actions, and therefore, hopefully, elicit positive response from the community, which in turn helps us, not just in the Ministry of Health, but as a nation. An indisciplined society cannot make progress. An indisciplined society is a liability to itself. And therefore, the more information you give, the more discipline in behavior that we can create amongst our people, the better off we will be as a society. And the less it will require us to do a lot of things that we do. It will require us less policing and save revenue. It will require less medication and save revenue. And this is money that can be used in other spheres and aspects of our society. But information also should facilitate conversation around the measures the government is taking to cushion vulnerable communities against adverse socio-economic impacts. It is also critical that the voices of the most marginalized to be amplified, those likely to be impacted more and more adversely affected, and the burden and reduction of the burden of the pandemic. Analysis around the issues and the measures that are taken. What is the impact, for example, of Mutahi in our society? I still remember last year when everybody in the world was talking about shutdown. Let's shut down, everybody. In fact, a friend of mine, I remember in Runda, calling me about 4 times, sometime last year in May, and saying, Minister, you have to shut down Kenya if you are going to, and the Ugandans were calling us, and the Rwandese were calling us, telling us, shut down this place. And I went to the president, and I said, Your Excellency, how do we do this? And President Kenyatta said, every society must behave and manage this virus in the best way it knows how. And it is not a situation where one size fits all of them. And the question was, what is the nature of a shutdown in Kibera? What is the nature of a shutdown in Mucheru kwa Jenga? What is the nature of a shutdown in densely populated areas where you have got 5 people in a small room? And it became very clear to us that that is not what to do. Instead of shutting people inside the houses, on the contrary, we move people out of the houses. And that's how Mutahi was born. So that to cushion the community, to cushion our young people, we give them work as a government so that we can hit two birds with one stone, or even three. You make a cleaner society because they weren't cleaning the streets. You save them from as much as a containment measure, because they are not crowding themselves in a small room. But in addition to that, you also cushion them financially, because we paid them to do the work of cleaning their own environment and their own areas. What's the impact of that? It would have been nice to see how the media, can be able to analyze that and just tell us. So it is now evident that strong, independent, and professional media can make a positive contribution in the realization of the containment measures being implemented by the government on COVID-19 through presentation of diverse opinions, ideas, discussions, and behavior change. And I can confirm, honestly, that there has been behavior change in our country. Nobody can deny that. I walked in this room, not one of you offered your hand. Not one of you said, "Hey, how are you, Waziri?" And gave me a hand. Even mine, I didn't. So, and the professor was what is it? Namaste. Nobody shakes hands anymore. If you don't think that is behavior change, when we know that we like shaking hands, even as we sit, you shake hands. As you are sitting, you shake hands. As you are leaving, you shake hands. And if you could sambaza hands, shaking hands, we would sambaza them, but we don't anymore. That's behavior change. And also, I also want to comment that as we move on, some of the changes that we have experienced in our communities, I want to ask the Media Council and the media as a whole, let us continue encouraging people, because we spoke about prevention. I think Isberi was talking about prevention. If we are going to make our society better, if we are going to deal with prevention of disease, I think that you in the Media Council and in the Fourth Estate as a whole can play a very, very important role in doing so. For instance, we spoke about setting up a cleanliness index across the country, a competitive cleanliness index, where counties will compete for the most clean county in the Republic. You can help us with that in the Media Council, and we want to work with you and UNESCO to the realization of this particular ambition, because we know what role cleanliness and hygiene plays in terms of primary health care. And we want to ensure that what we have learned during COVID-19 and the advantages that primary health care has provided to the nation is something that you do not want to lose post-COVID-19. So we are asking you, as you set up the portals, this and the other portals that you are going to set up, let this be a beginning instead of an end. Let there be more engagement. UNESCO, if I were to say where you should put your most of your money this year, put it in this group. Put it in this with the media. Let's work with them and enhance their role in society as far as information is concerned, so that we can achieve some of the objectives we have set for ourselves as a result of what we have learned from COVID-19. I'd also like to say that make an announcement even as I close my remarks, and say first, there will be an extension effective today of the containment measures, including the curfew hours that are there. And this is for two reasons. Number one is that we are still, as far as the positivity rate is concerned, we are still above the WHO recommended figures in terms of a 2 weeks period when you have got less than 5% of positivity rate at a high testing level. Secondly, we need at least the 30 days that we are going to extend the time to, so that we can vaccinate as many people during that period as possible. As we head for the Christmas holidays, we need to ensure that as many people in this country have been vaccinated as possible. It is the only way we can be able to fully open our economy, and we hope to do so, during the period that we have announced. So in consultation with the National Emergency Response Committee on Coronavirus, and obviously consulting with His Excellency the President, the government will indeed announce an extension of the hours that we have got for the containment measures to remain the same until perhaps by the end of this month. And therefore, my colleagues, ladies and gentlemen, it is with these few remarks that I now declare the Media Council COVID-19 Information Portal officially launched.
To show us something, what we are